Cancer remains a significant public health problem worldwide, and is the second leading cause of death in the United States. Cancer is a chronic disease that isn't isolated to one group. Dads? Moms? Your neighbor? A friend? If it's not you, it could be someone you know. In 2020, the diagnosis and treatment of cancer were hampered gravely by the pandemic. It has reduced access to care because of healthcare provider closures. Resulting in delays in diagnosis and treatment. This crisis may seem overwhelming. But it doesn't have to be. The American medical system has had the help of Filipino nurses at its front lines for decades. The reason for this is more profound than the demographic of being a stable and reliable workforce. The Filipino people themselves make a difference, whose adaptable nature and work integrity create most of the backbone of the U.S. healthcare system. Filipino nurses are considered one of the best for hospice and palliative care for patients with chronic diseases. Our inherent tight family bond, filial piety, and malasakit have been the Philippines' cultural asset. Both nurses and doctors have suffered and continue to be under tremendous strain since the onset of the pandemic. Approximately 4.5% of the nursing workforce in the U.S. are Filipinos. With our nurses and other healthcare professionals at the forefront, it can benefit them greatly to have a supplementary service that reduces exposure while maintaining quality care for anyone. Even from afar, the Philippines continues to bridge the gap by utilizing our highly skilled doctors and nurses in the country through telehealth services, from patient engagement, claims management up to revenue cycle management. In the last 5 years, Visaya decided to focus more on higher value-add processes in healthcare information management, utilizing Filipino healthcare talent to service the U.S. market through chronic care management and transitional care management services. These services have helped patients with chronic diseases before and especially during the pandemic. Visaya is well positioned to deliver solutions to these goals by providing highly skilled medical coders and billers that are RNs, USRNs, and MDs, who supply value-based care with better quality at cost-efficient rates. From real-life medical frontliners in the US to telehealth frontliners in the Philippines, patients with chronic illnesses through Visaya and companies like them can safely and seamlessly connect the patient to the care they need. Visaya Knowledge Process Outsourcing Corporation provides services for the management of the entire revenue cycle, medical coding, clinical documentation improvement, practice management, care management. Dedication and commitment. Excellence and innovation. Accountability and integrity. Malasakit, through servant leadership. Filipino talent and skill has always, and will continue, to rise up to the challenge.